Hello everyone and welcome back to my channel. So in today's video we will see the important questions of head, face and neck anatomy. We will start with LAQs which are of 10 marks. So first important question is anatomy of skull. It is commonly asked LAQ in which you need to write the extent of the skull, layers, you need to enumerate all the layers and write in detail about them. Then blood supply, nerve supply and lymphatic drainage, everything with help of diagram also. Then second is deep fascia of neck and its clinical importance. Investing layer, tracheal fascia and all you need to write, and neck infections and all in clinical importance. The third comes posterior triangle of neck. In this you need to write the features, boundaries, divisions and content of the posterior triangle with the help of diagram. Then fourth is carotid triangle. In this also you need to write the boundaries and contents and also draw the diagram for the both. Then the cavernous sinus. Here I have already mentioned the subpoints, that is situation, formation and relation, tributaries and drainage channel and clinical importance. Then sixth is thyroid gland. Here also I have mentioned the subpoints, that is gross anatomy and its relations, capsules, development, blood supply, microscopic anatomy and applied anatomy. Whenever blood supply is asked, make sure you write both atrial supply and venous supply. Then seventh question is parotid gland and the subpoints are capsule, surfaces and relation, intragrandular structures, microscopic anatomy, secretomotor nerve supply, blood supply and applied anatomy. This is also one of the important LAQs. Then eighth is temporomandibular joint. For BDS students, this is very important LAQ, and these subpoints are articulating surfaces, ligaments, relations, movements with muscles, applied anatomy. This is very frequently asked LAQ. Ninth is muscles of mastications. This is also very important. You need to write their origin, insertion, nerve supply and action with the and this four are the muscles. Next question is submandibular gland. In this the points are gross anatomy, relations, nerve supply. Secretomotor nerve supply is important, but you need to do all the nerve supply, microscopic structure and applied anatomy. Then comes soft palate. In this you need to write the morphology, muscles, blood supply, nerve supply and development. In all the LAQs you need to draw diagrams. Diagrams are very important. Next question is on paranasal air sinuses, of which maxillary sinus is very important, and these subpoints are features and relation, communication with the nasal cavity and applied anatomy. You need to do maxillary sinus very properly. It is also in dental histology. So the next question is describe lateral wall of nose, and the important points in this is features, atrial and nerve supply and venous drainage with diagrams. The next question is palatine tonsil with points, features, atrial supply and nerve supply and venous drainage. The next question is tongue with the subpoints, morphology, muscles, nerve supply, blood supply, development, microscopic anatomy and papilla, of which circumvallate papilla is the most important. Tongue is also very frequently asked LAQ. So all these are the important LAQs of head, face and neck. Next, coming on to SAQs. So the first SAQ is of facial artery. The second is of sensory supply of the face. These are important. Then third is orbicularis oris oculi muscles. This is not frequently asked, but it is important. Then there is nerve supply of face, of which sensory nerve supply is the most important supply. Then comes enumerate the muscles bringing depression of the hyoid bone. Then buccinator muscle and muscles of facial expression. Of this, mainly buccinator muscles comes as a question. Then seventh is sternocleidomastoid muscle. This is also very important SAQ, and it can also come as LAQ, but it is rarely asked as a LAQ. Then ansa cervicalis. This is also very important. Then it is superior sagittal sinus. You need to enumerate the paired and unpaired venous sinuses of dura mater. You can also draw the diagram. Then structures in the lateral wall of cavernous sinus. Muscles supplied by oculomotor nerve and its two clinical features, intrinsic and extrinsic muscles. Then digastric muscles, also the posterior belly of digastric muscles and its embryological relation can come as a separate SAQ. Then external carotid artery, its branches and diagram is also very important over here. Secretomotor supply of parotid gland, inferior alveolar nerve. Then contents of temporal fossa, infratemporal fossa, its boundaries and contents, submandibular ganglion, external jugular vein, styloid apparatus, it is also very important. Tributaries and internal jugular vein, carotid sheath is also very important. Then strap muscles of neck, constrictor muscles of pharynx, oropharynx, muscles of soft palate with nerve supply. Then there is Voidale's ring. This is also very important. Then tonsillar pain is referred to middle ear. You need to explain this with applied anatomy. Then structures forming nasal septum and its nerve supply, paranasal air sinuses, enumerate with function. This has also come as an LAQ. Dangerous area of face. You need to draw the diagram for this also. Openings in the meatus of nose with diagram, of course. Insertion of larynx, movements of vocal cords, enumerate cartilages of larynx with diagram, boundaries of laryngeal inlet, nerve supplying muscles of larynx, muscles altering tension of the vocal cords, hypoglossal muscles, mylohyoid muscle, lingual artery, medial wall of middle ear, auditory tube, and what is pterion and its surgical importance. So this 47 are the important SAQs which can come in your exam from the section head, face and neck. You know this is very important section for anatomy for BDS students, so you need to prepare this very well. Also, if you want this PDF, I will give it in the in my Telegram channel, which I will mention in the description box, with all the important questions of anatomy after I complete my series of important questions of anatomy. So thank you for watching and all the best for your exams. Take care. Bye bye. Do like, share and subscribe. Thank you.